Hello everyone, today we're going to discuss the neck fascia. The neck fascia divide into in different parts. Okay, first we're going, if you remember the superficial, after the skin we have superficial fascia, and this fascia covering the whole bodies. After the skin, under the beneath the skin we have fatty layer, and this fatty layer also covering by superficial layer, and this superficial layer covering the whole body. Okay, and in the cervical, this if the neck, this is in the this perspective of the neck from the upper side. Okay, and here we will see the muscle easily, and we will identify the each facial layer of the neck fascia. Okay, first if you will talk about the neck fascia, we have cervical fascia. Okay, and this cervical fascia are going to divide into three main fascia, which is superficial fascia, then we have pretracheal fascia, and third one we have prevertebral fascia. Okay, now I will show how this fascia layer, this cervical fascia layer covering the muscle. Okay, I already told this is the skin. Under the beneath skin we have fatty layer. Okay, and this fatty layer always covering the fatty layer always covering by superficial layer. Okay, like the whole body. Now our topic about the cervical fascia. Here this is the trachea. Okay, and this is the esophagus. Okay, and here we have vertebra, cervical vertebra. If you will discuss this, it means this is the anterior view, or anterior side, and this is the posterior side, because here the trachea is interior and vertebra is posterior. Okay, now the spine process. Now we will talk about the first superficial fascia. Now this is the platysma muscle. Okay, platysma muscle, and platysma muscle also covering by the superficial layer of our all body layer, which superficial fascia, which covering also the platysma muscle. And here if we will talk about the superficial layer of the cervical fascia, these are covering the muscle here like that. This superficial muscles, this one is trapezius muscle, and this is the sternocleidomastoid muscle. They are covering sternocleidomastoid muscle and trapezius muscle of cervical fascia. Okay, superficial fascia of cervical fascia covering this is which I underlined. This is covering by sternocleidomastoid muscle and trapezius muscle. Okay, it means trapezius muscle and sternocleidomastoid muscle are covering by superficial fascia. Okay, now the second fascia, pretracheal fascia. I already told, this is the in front of the trachea we have, this is a thyroid glands. Okay, thyroid glands. If you talk about in the front of thyroid glands, there we have infrahyoid muscle. Okay, it means the pretracheal fascia covering the infrahyoid muscle. Okay, in front they are covering the infrahyoid muscle. If they are going to the side of the thyroid glands, there we have sheet which covering the carotid artery, internal jugular vein, and vagus nerve. Okay, and this sheet is called carotid sheet. Okay, it means infrahyoid muscle are covering in front by pretracheal fascia. Okay, and here the side they are covering by the carotid artery, common carotid artery, internal jugular vein, and vagus nerve covering by carotid sheet. Okay, these are the pretracheal fascia of the cervical fascia. Now the prevertebral fascia. These are the prevertebral, means with in vertebra side. Okay, and prevertebral fascia means here we have when we discuss the deep group of muscle of the neck, the prevertebral fascia covering the deep muscle of the neck. They are covering, these are the deep muscle of the neck, and this deep of the muscle of the neck are covering by the prevertebral fascia. Okay, again we will I will going to discuss like the short summary of this again. If you don't understand this, the prospect of the neck. Okay, here we will see easily the muscle in interior wave and posterior. Okay, Now cervical fascia divided into three fascia: superficial fascia, pretracheal fascia, and prevertebral fascia. If you will talk about here and beneath the skin, this is there we have the one layer, a superficial fascia, which covering the our whole bodies. Also we have also cover here in the neck region, also they are covering the fatty layer and platysma muscle also. Okay, but the main superficial fascia in cervical fascia covering the sternocleidomastoid muscle, superficial group of muscle, and trapezius muscle. Then pretracheal fascia covering the infrahyoid muscles and also carotid sheath. Then prevertebral fascia are covering the deep muscle of the deep muscle of the neck. Okay, but between the cervical, between the esophagus, this is esophagus, and here in the prevertebral fascia, there we have this one, we have buccal fascia, and this one we have alar fascia. Buccal fascia, or we can say buccopharyngeal fascia, because these are behind the pharyngeal. Buccopharyngeal fascia and alar fascia. There are two new fascia here. Okay, between the esophagus and prevertebral fascia. Okay, and between buccal pharyngeal fascia and alar fascia, there we have one space, and this space means retropharyngeal space. Okay, this retropharyngeal space is very important, and this for the during the surgery for which surgery, when we like dissected the cervical vertebra. Okay, it means we have retro means behind pharynx, and this means retropharyngeal space. Pharyngeal space. If you talk about retropharyngeal space between what two fascia, one is buccopharyngeal fascia plus alar fascia. These are this one. Behind the esophagus we have buccopharyngeal fascia, and in front here we have prevertebral fascia, where we have alar fascia. Okay, and between them we have space, retropharyngeal space, and here between alar fascia and also prevertebral fascia, we have another space, and this space means Dengar space or alar space. Okay, Dengar space or alar space. Dengar or alar space. Okay, again we have cervical fascia, which covering the cervical neck muscle. Okay, cervical fascia divided into superficial fascia, pretracheal fascia, and prevertebral fascia. Superficial fascia covering the sternocleidomastoid muscle and trapezius muscle. Pretracheal fascia covering the infrahyoid muscle of the neck. Prevertebral fascia covering the deep group of muscle of the neck, and there between two other fascia behind the esophagus we have buccopharyngeal fascia and alar fascia, and between them they are making a space. It's called retropharyngeal space, which are very important during for the surgery of the cervical vertebra. Okay, and behind the retropharyngeal space there is another space, small space is making, and this space named alar or Dengar space. Okay, thank you for watching. This is about the